Good afternoon, everybody. My name is Jeff DeBoer. I'm President and CEO of the Real Estate Roundtable. Welcome to our video blog series on the economic impact of the COVID-19 healthcare crisis. If you've joined us in the past, you know that we have focused on economic policy issues such as the Federal Reserve lending facilities, the TALF in particular, the CARES Act, the Payroll Protection Plan, and we've focused on tax issues or changing deadlines and suggestions for debt modification that we know is going to come up. Now, we're all familiar with the situation where cities and states are slowly reopening parts of their economy and parts of their business community. And so it is with great pleasure and privilege today that we have as our guest Dr. Joseph Allen. Dr. Allen is the assistant professor at the T.H. Chan School at Harvard University. He's also the professor and the chair of the Harvard University School of Healthy Buildings. He's the author of several books, one of which is just out called Healthy Buildings, by the way. You can pick that up at Harvard Press. It's a fantastic resource for all of us. And obviously, he's no newcomer to us. Many of you have seen him at our roundtable meetings in the past, in particular at our Sustainability Policy Committee that is chaired by Tony Malkin. And we're always excited to talk to Dr. Allen. So today, we're going to talk about what building owners and managers should be doing to safely reopen their buildings in the next few weeks, and maybe what we should do in the short term and the longer term to keep our tenants safe and the visitors that come to our buildings safe and sound. So please, first of all, may I call you Doctor or Joe, or what would you prefer, sir? Thank you for being with us today.
Hey, Joe. Thanks, Jeff. Yeah, it's great to be talking with you. Appreciate our chances for interaction over the past couple of years through the Real Estate Roundtable, thinking about sustainability, green buildings, all the way through this burgeoning healthy building movement, and now through the COVID crisis.
Well, thank you, Joe. And again, it's a pleasure to have you here. There's a number of things that maybe we could start off talking about. What are the major strategies that building owners and managers should be taking as we begin to reopen in various businesses in cities and states around the country? People take 2 million breaths in their office, you say, and the virus obviously is transmitted and lives for a long period of time on different surfaces. So please share with us the top strategies. Of course, we know, and I think you would agree, that achieving a zero risk situation here is not really possible, as it's not really possible in any situation. But what are the top strategies that you think we should be undertaking?
I'm glad you mentioned that, right? So there's no such thing as zero risk. The goal here is to minimize risk, and there are actually strategies we can take to do that. And that line of on a typical year, we breathe 2 million breaths in our office came from this Harvard Business Review article I published this week, which outlines all the strategies companies should be thinking about in terms of control strategies to minimize risk in their buildings as they set in plans for return to work, or better said, return to office strategies. So really the way I've been approaching this, is from a public health standpoint, and we have to ground everything in the science first, because that fundamentally then determines what control strategies you put in place. And here we start with we have to understand how this virus is transmitted. Clearly, it's highly transmissible, and it's operating across all three modes of transmission. So large droplet transmission. If I cough or sneeze, these are the large particles that will settle out rather quickly, and they inform strategies of physical distancing. Stay 6 feet away from others. There's also what we call fomite transmission. A fomite is any inanimate object that can act as a source of transference for the virus. So this would be a doorknob or a desk. And the control strategies there are, we need frequent cleaning and disinfection, constant hand washing, don't touch your nose and your mouth. The third one is airborne transmission. It's also clear that airborne transmission is a factor here. So when we cough or sneeze, some of these smaller particles will stay aloft for a long time, or several hours. And here, this is where the strategies related to healthy building strategies come into play, like increasing the amount of fresh outdoor air that comes inside, increasing the amount of filtration in your building. So while we have these kind of three modes of transmission, it's somewhat of a false construct. If I'm sick and infectious and shedding viral particle and I cough, large particles will settle out. That's large droplet. They will contaminate some surfaces. That's fomite transmission. And then I don't just cough or sneeze small particles. Some fine particles will stay in the air. So it's a bit of a false construct. Really, it's a continuum. But the good thing, I think the important thing is that if we look at the science, there are steps we can take to address all modes of transmission in our buildings. And as you say, not get to zero risk, because there's no such thing in anything we do, but get to an acceptable level of risk where people will feel comfortable, and we will feel comfortable with people being inside of our buildings.
Thank you. I have a couple of observations that I wish you would maybe comment on. One is, are buildings today even designed to be healthy buildings? And secondly, listening to all of this, it strikes me that this is similar to how we see the energy efficiency discussions, and that is that buildings themselves do not consume energy. The tenants in them do. Of course, you have to manage them in an energy efficient way. So isn't this also about a shared responsibility between building owners, managers, and their tenants to make sure that as much positive health environment can be created, just as it is in an energy savings environment?
It's hard to generalize. I would say, as we all know this, there are good and bad buildings, right? And there are poorly designed buildings and great buildings and poorly maintained buildings and well-maintained buildings. It's clear that historically, and even with this virus, that buildings can either help spread the disease or can actually help mitigate the disease. I'm on record with an article in Financial Times in early February saying that healthy building strategy should be our first line of defense in helping to mitigate this. So if your building's operating well, it can certainly help in the fight here. And again, those strategies are tried and true, and they're based in the science. I think some of the problems we have is that many times we hit these code minimums, which are designed for things that aren't necessarily about health, or they're not certainly designed with infectious disease in mind. So there are things we can do to improve that in our buildings, and there are steps that we can take that actually don't cost all that much money. In fact, well, relative to what we're seeing now, of course, it'd be trivial compared to the losses the economy is facing right now. But if we're going to return this economy back around and restart the economy, what we're going to have to do is make some of these investments in our buildings, deploy some of these healthy building strategies, one, to mitigate risk, but two, communicate that to the public, that a wary public that doesn't want to go back into buildings just yet. So we're gonna have to show them all the steps we're taking, even those ones that are invisible, right? You won't know if I do something up in the ductwork that helps to trap the virus particles in a filter. So we're gonna have to communicate that clearly, that these are the steps that you see and these are the steps you don't see that we're taking to protect you while you're in our space.
Thank you for that. On many occasions, you've articulated a view of sort of the 9 foundations for a healthy building that building owners should have. Would you like to walk us through that? I think that's very important for our listeners and viewers to understand.
In the book, we talk about, and release this at Harvard too, the 9 foundations of a healthy building. And interestingly enough, Jeff, this came from one of the meetings I was at the Real Estate Roundtable. It was early on, several years ago. We were talking about sustainability. We started to talk about health. This is early on in the healthy building movement. And I said something to the effect of, look, I think we're overcomplicating what it takes to have a healthy building. And a lot of people kind of leaned in. I said, there's just a handful of things we have to do. And a whole bunch of people followed me to lunch. We went to lunch, and we had a great lunch there. We talked about this for a long time. And it really struck me at that moment that maybe we had failed in public health to translate what I knew was all this great science, but it hadn't reached the market. So we created this report we call the 9 Foundations of a Healthy Building, which takes those 40 years of scientific evidence, distills it down into those key factors or features that we know relate to better employee health, employee better productivity, and help reduce infectious disease transmission. And it's some of the basics like we've been talking about: ventilation, air quality. How do you control moisture in the building? What about water quality, lighting and views, biophilic design, acoustics? All of these factors kind of fit in. In fact, safety and security fit in. You just mentioned that. So it's all this that are, again, really get down to the science, and right to its core. There's a lot of science that's on the sidelines that hasn't been fully leveraged by the real estate community, in my opinion. And we're trying to help there by translating that. I think a lot of people are seeing that right now with COVID, that one of the most challenging parts here is to there's so much information coming out. How do you distill it down to what you really need? And so the same thing applies for healthy building strategies broadly defined beyond COVID. If I told you there's 40 years of science, well, I wouldn't expect you to go read all of the scientific journals over that time period. So it's our job to take it down to its core and say, here, market, this is really what you need to do if you want to have healthy people in your office. And we go a step further in the book and we say, this isn't just good for health. It's good for business, bottom line profits. The co-author on my book is another Harvard professor, but from the Harvard Business School. He's a real estate finance guy. So, we paired up the health discipline with the business science discipline and merge it to show that, hey, this is a good decision for the health of your employees, but also the investments you make will pay back in multiples to the bottom line of your business.
That's quite interesting. And I know a lot of people will be interested in this question and answer. At least I hope they will be. How would you even know if you're being successful? In other words, what kind of a metric would a building owner use to determine whether they were making their building more successful? And in fact, if they were doing that, how would they translate that into the marketplace? How would they receive back their investment into making their building more healthy? Because all of this does cost money. And so share, how's the metric and how do you translate it into the marketplace?
Great question. In the book, the way we talk about it is, and I'm not trying to sell books here, but just some of the lessons in the book, we talk about the need to take the pulse of your building. So the only way to really know it, right? You can't manage what you don't measure. It's business 101. And so we say, well, you need to start measuring the performance of the building, taking the pulse. You go to the doctor, what's the first thing they do? They take your pulse, they take your blood pressure. We don't really do this for buildings. So here you can start to measure what we call health performance indicators to get a sense of how your building is performing, to be sure you're capturing all those gains, right? You make the performance improvements in your building, it leads to better benefits to your people through all of the great science, and you want to be sure day to day you're hitting those targets. So that's one way, we can take the science, but then turn it into something, well, here's what we have to do, here's how we have to measure it. If your listeners are really interested in this, with my co-author of that book, we also wrote a Harvard Business School case study called A Tower for the People. It's about 425 Park Avenue in New York City. And it was just featured on Harvard Business School and Harvard Business Review podcast called Cold Call. And in that case, we walk through the economics of this building, and we encourage our students to do it too. And we look at the decisions L&L Holding and David Levinson made at 425 Park Avenue around health. And we evaluate, and we have the students evaluate, whether or not this is a good decision. We hope they come away with the conclusion that we came away with, that like we've been talking about, the investments on the health side are really quite small once you include health in the cost-benefit analysis, health and productivity.
Okay. Well, not to put you on the spot or anything like that, but suppose you were a building owner. I hope this is an appropriate question to ask you, but let's suppose that you were a building owner. What would be the short-term actions, the quick actions that you would want to take immediately as business starts to reopen? And then perhaps as we get down, you're going down the road another month or month and a half, how do you build on that, and what do you do differently as you continue to populate and repopulate your building?
Good question, and I like the way you framed it. It's smart and thinking, well, what do you do right now in a period of low occupancy? So I'd say first and foremost, there's some things you should be thinking about your building, including about how you're handling the water system, right? Stagnant, stale water is a great place for other bacteria like Legionella. But let's get to the meat of it here, which said, well, what should I do in my building to mitigate or minimize risk? And here is what I would mention, what I wrote in this Harvard Business Review article published last week, where we use the hierarchy of controls. 5 steps, comes from my field of occupational worker health and safety. And the first one is you want to eliminate the hazard. So that means work from home strategies where you can, but that's not the path to restarting our buildings or the economy. The second one is personnel substitution. So who are the core people that have to be back on day one? And then you slowly expand that over time as you show you can keep everybody safe. The third in the hierarchy of controls is engineering controls. These are the healthy building strategies we've been talking about. Fourth are administrative controls. These are things like largely under the umbrella of de-densifying your building. How are you going to manage queues at your elevator? How are you going to manage the lobby? Are you going to do screening, temperature screening? So this is everything around the administrative side of this, and creating extra space for people. And last is PPE, for personal protective equipment, and that's the use of masks and the like. So I like this as a strategy because it's grounded in the science. It also fits what you mentioned earlier, Jeff, about how we approach security. We approach security as there's no foolproof security. We approach it as a layered defense. And so the same should apply for our buildings with COVID-19. There's not one silver bullet here that says, oh, if you just put this in your ductwork, you're fine, you're done for the day, everybody's safe. No, just like security or cybersecurity, you have to take a layered defense approach. And if you put all these controls in, I feel quite confident that we can keep people safe. And as a phased approach, you start to escalate or reduce the restrictions over time when you can show that you can keep people safe in the building. And importantly, probably most importantly, in response to what is happening in the region where your building is in terms of disease dynamics. Are you in the middle of a New York or New Jersey right now? Would be different from other parts of the US right now. And that will change over time. And we know it's going to change over the next, through the end of the year at least.
Thank you. Of course, all of this depends in many respects on the health crisis itself and how rapidly or how long it takes to develop a vaccine. Typically, I think, it's usually, I understand, 12, 18 months or something like that for a vaccine to be developed, probably closer to 18 months. So it seems like you're suggesting strategies that would be phased in over a period of time to recognize the situation with the vaccine. Obviously, this is going to be with us not a short term, but a longer term. So building owners should be prepared for phasing in, I think. Is that your message?
Exactly right. If you look at the epidemiological models, we're going to be dealing with this for a while. It's going to come and go in waves. We see how easily transmissible this is. None of us have immunity to it. There's a potential for seasonal forcing, which is the epidemiological way of saying we might have a second wave that's even bigger come November, December, and this winter. So it's something, in terms of the vaccine, yeah, that is the end goal here. 18 months actually would be the quickest we've ever developed a vaccine in human history by twofold. And there are no guarantees with that vaccine either. So, but I'm actually confident that we have to, and we will get to a place where we can manage this through other means, right? So if we get active on what we should be doing in terms of testing, contact tracing, isolation, quarantine, putting in these control practices in buildings, we can get to a place where we can manage this. And it's going to require, though, that building owners and companies have plans in place that are not like traditional disaster response. Let's say a hurricane blows through, you pick up the pieces and then you march on. This one we're starting to build knowing that we might have to take steps back occasionally in response to what's happening in our region. So it's going to be much more dynamic than past crises. The good news, or I'd say the reason for optimism, is that for the first time in history, every scientist in the world is focused on one problem. And already we're starting to see scientific and medical breakthroughs. And they're not always headline news. I don't think you're going to see COVID cured on the front page of the Wall Street Journal. But slowly these wins are starting to happen, and I expect they'll continue over the ensuing months, so that we'll get to a place where we can manage this effectively even before the vaccine. In fact, we'll have to get there to keep our economy and society functional.
Yeah. Well, obviously, building owners are going to be keen on implementing many of your strategies, I think, and ideas, and others that will come to fore in the coming days and weeks and months. But all of this, of course, will cost money, and it will also be hindered or encouraged by certain aspects of public policy. We're a public policy organization, as you know. Can you identify any public policy areas, laws, regulations that currently should be put in place to enable buildings to be more healthy, or in fact, are there some under the current regime, excuse me, that might be better eliminated in order to help facilitate a more healthy building environment?
One of my frustrations is with some of these codes, right? So we target these code minimums that are not designed with health first. I'll give you an example of one. If anybody knows me or seen my work, I talk a lot about ventilation and the power of fresh outdoor air to provide all sorts of benefits. My own research has shown benefits to cognitive function. I've shown this, I presented this at Real Estate Roundtable for several years. There's benefits to infectious disease transmission. But if you look at what happened historically, these ventilation standards, going back to the early 1900s, used to be set, Jeff, on infectious disease transmission. And we got away from that in the 70s. And we started, our focus became energy, which is important. I'm not minimizing that, but it came so much so that we started to tighten up our building envelopes where we started to choke them off. And that gave rise to, unfortunately, some buildings and became sick buildings. And it's that era. So, you know, you can actually trace some of these decisions back to codes set where health wasn't the primary driver of the decision-making in buildings. And we see that through a lot of decision-making in buildings, be it in schools, commercial real estate, factories, you name it. But I think what's going to happen for sure, in terms of policies, maybe you can influence, but you know, this healthy building movement, just like working from home and teleworking, had been slowly rising. And with COVID, it has forced a massive quickening of these movements, right? We all are very adept at this point of doing Zoom work from home meetings. All of a sudden, everyone is talking about healthy buildings, whereas for the past couple of years, it's been more of a pull. I've had more people reach out to me in the past 2 months than ever before, because I think there's this recognition, and certainly this will happen, is that people's expectations are different, right? Next time I go into my office, I'm going to look at the doorknob. I haven't thought about my doorknob ever, but I'm going to, just like you are, and everybody will, right? And then we're all going to start to look around a bit more and say, you know, I hadn't really thought about the acoustics in here. I hadn't really thought about the lighting and these other factors. And it's a different recognition that the built environment and buildings have an important role to play in our health. So I think this is the moment where healthy buildings arrived and will stay.
Well, thank you very much for that. This has just been I think, a very fascinating discussion. I've certainly learned a lot from you, and I've learned a lot in reading your materials, preparing for this, and watching you at past roundtable meetings present your thoughts. We look forward to having you at future roundtable meetings, continuing this discussion. It really is both timely and very informative for our people. Are there any closing thoughts or comments that you'd like to make? One that occurs to me is just how similar this is to both energy efficiency and security in buildings, and that is in my view, a shared responsibility between the owner of the building, the managers of the building, the tenants, the people who come in as guests into buildings, regardless of the type of buildings. And it just strikes me that we all have to be working together. Maybe it sounds a little bit naive to suggest that, but it's certainly a course of action that we've pursued in the security area, in the energy efficiency area, and I think it's going to be one that we will want to pursue in keeping our buildings healthy and the people inside them healthy. Any closing thoughts or comments that you'd like to add?
Forward to continue the conversation, because I think, well, I know, and having done a bunch of these or working with a lot of these big companies, is that there are a lot of questions, right? We could take this conversation to a million different places, but it'd be nice to hear what your members are thinking, and we're happy to answer those questions and take it there. And the last thing, I'll just maybe reiterate what you were talking about, because I'm really glad you ended with that point on this shared responsibility idea, because I've been advising many companies in this space, and it's not that, you know, the building owner has responsibilities, but the tenant has responsibilities, and actually a third, the individual has responsibility too. And if it gets to a headbutting phase, it's going to be a problem that's not going to work, right? It has to be that the building owner takes care of what they have to take care of, and close coordination with the tenant organization, in close coordination with employer, the visitors and the guests' responsibilities for their own behavior too. And because if it doesn't work that way, then everything's going to get scaled back. And as we talked about those phases, if everyone's not working together on this, the whole economy is going to have to phase back, because it'd be a problem. So the way forward is this kind of this really deep trust between all three parties, and that's
well, that is absolutely true, and that leads us into another topic of discussion, which would be liability concerns that building owners and managers will have, and employers will have as well. But that's a topic for another day, another time. Today, I think I just want to thank you again. It's been a privilege. It's been very, very informative. We look forward to future interactions, hopefully at a roundtable member meeting soon. And we wish you good health, and we wish good health and safety to all of our viewers. And thank you for listening, and please contact us. If you have any questions, go to our website. We have all kinds of material on our website that we think is informative and will help you. And I would also say that it's not just the Real Estate Roundtable that has this kind of materials. Obviously, every product sector, if you will, in the real estate industry has this. The International Council of Shopping Centers has retail advice. BOMA, Building Owners and Managers Association, has advice there, as do nearly all of the organizations, NAIOP and others. And so I would just say visit those. Let's follow the CDC and the health officials' guidelines, and I think we'll be in good stead, and hopefully we can get a vaccine sooner than 18 months, Dr. Allen. But thank you again, sir, for your time. Good day, everyone.